Did you make a face?
No. I have to come back this way so that I don't turn back to the camera.
We'll just rewind.
Anyway, I do like moonwalk if I know how to do that. Okay, so today, IBU, be sure that you look at that half sheet, I gave you that full sheet. Be sure you know everything on the half sheet. And the bottom part that has the questions on it, there will be a sheet in here with those questions on it. So the bottom part that says IBU questions, you do not have to memorize all this. You will be able to read it. There'll be one in each room. The key to reading this will be asking the question, waiting for a response, then moving on and putting it at a good pace and not talking too quickly.
Don't read it like a robot.
Yes.
Have you ever had a...
And that's it exactly, because if you were doing one at the clinical site, you'd have the sheet you would read off of, you'd mark everything, and then they would sign off on it. So there's no reason for you to memorize all this. But this isn't everything you have to ask. So be sure you read that little half part. Oh, I forgot to tell everybody today about the, we can still do it Monday, about the TOMO thing. Because on that half sheet it talks about the TOMO and the tube moving, but I didn't do that in any of the labs, so I'm not going to ask y'all to do it in the lab. So you only have to do the things that I did today. But look at that and look at the communication form. You'll see that most of the things are repeated from what we did with the GI and the VE, but there's a couple of different types of things. And remember that everybody's diabetic, okay, and everybody takes metformin. Because I want everybody to get used to that and knowing what to say for that particular thing. So answer yes, you're diabetic, and they ask you to take any medication, or if you're taking metformin, say yes, you are. You'll know more about that on Monday when I lecture on contrast media, and we'll talk about why that's important, why that metformin is important. So, okay, but realize you will have this sheet with you.
So what did you say on here we didn't have to know was to describe tomograms?
Yes, you don't have to describe the tomogram.
Okay.
But everything else, yes.
So just the tube will move over your body from head to toe?
Yeah, that's
But
part
we
you
will
don't
not
have to
touch
say.
you?
Correct.
We don't have to say that.
You don't have to say that part because that
Okay.
describes the tomo part. Okay? All right. Ms. Eds?
Yes,
Like you were really in the waiting room reading the paper.
I really was. Yeah.
Hi, my name is Gina. I'm going to be doing your exam today. If you'll come with me, please.
Sure.
Okay, Ms. Eds, I see, can you repeat your full name for me?
Okay, that's
And your date of birth?
August the 1st, 1955.
Okay, I'm just going to check your armband. That all matches up. Okay, I see that you're here today for what we call an IVU or intravenous urogram kidney study.
Okay.
A kidney study, is that correct?
Yes.
Are you here about your kidneys?
I am.
Okay, what kind of problems have you been having?
A lot of back pain and some blood in my urine.
How long has that been going
A
on?
couple of weeks.
Okay. Now, when she walked in, distracted. Okay, have you ever had any kind of x-ray test where they had to start an IV and give you something called contrast media or x-ray dye?
No.
Okay, well, we will be doing that today, and I'll
Okay.
talk to you about it. So you've never had a CT where they did that or anything like that? Okay. All right. I'll let you come in and have a seat. I have a few questions I need to go over with you.
Okay.
Is there any chance you could be pregnant? Okay. And did you do the prep last night?
I do.
That's good. And have you had anything to eat or drink today?
No.
All right, that's good. I'm sorry. I'm sorry about that, but hopefully this won't take very long.
Okay.
Need to ask you a few other questions. Do you have any allergies to any medications?
No.
Okay. Any food allergies?
No.
Okay. Do you have an allergy to latex?
Mhm.
Okay. Do you have an allergy to iodine or betadine, like they clean wounds with or
No.
anything like that? Okay, that's good. And I'm going to ask you a few medical history questions as
Okay.
well. Do you have diabetes?
I do.
Okay. Do you take any medication for that?
I take metformin.
Metformin? Okay. Did you take it today?
I did.
Okay. I'll give you some specific instructions about that later.
Okay.
Do you have myeloma?
I don't.
Renal disease?
No.
Sickle cell disease?
Mhm.
Any heart problems at all?
No.
Okay. Any regular allergies like asthma or hay fever or anything like that? Okay. Any seafood allergies, particularly shellfish? No. Okay. All right. And that should be all I need to know there. I'm going to explain to you a little bit about what we're going to do. Before we get started, I'll shoot a couple of images to look at your abdomen and your kidneys to see how well that prep worked that you
Okay.
took last night. And then I'm going to show those to the doctor. Then we'll come in and start that IV in your arm.
Okay.
We'll inject the contrast. It sometimes makes people feel warm, it makes some people feel cold in their arm. It really varies from person to person, but you could feel that in your arm a little bit. Sometimes some people get a metallic taste in their mouth, just kind of a bad taste in their mouth. You'll get, a lot of them get like a warmth all over their body, and in particular, we have people tell us that they feel like they may need to urinate or that they're going to urinate on themselves. You'll feel a great warmth in that area. That is completely normal. Don't let that frighten you at all, and you have not urinated on yourself. It'll really be okay. All right. But I like to tell people about that. I know first time I had one and nobody told me, I was like, oh, it's kind of nice to know. It's a little shocking if you don't expect it. All right, any questions about any of that? Okay, then I'm going to need you to change into a gown. I want you to take everything off. You can leave your panties on as long as there's no metal. Your jewelry will be okay, but if you have a belly button ring, if you'll remove that. And while you're in the restroom, I need you to empty your bladder before we get started. Okay? Here's your gown. Just put it on open to the back. Okay. All right. She's back. Okay, Miss F, if you'll just go ahead and lay back on your back for me. This nice paper gown that we have is so easy to manipulate and drop on paper. Okay. Alright. So, we're going to pretend to shoot our scalp films like we did before. I don't think we need to see y'all shoot another KUB. I think we've seen that a few times already. Okay, will you be alright while I go check these? Yes, ma'am. Okay, and the tube's out of the way. Alright, I'm back. Alright, we're ready to start that injection now. Okay. Which arm is better for your IV? Your right one? Okay. Alright, go ahead and tie the tourniquet. Check the contrast. You feeling okay? Yes, ma'am. All right, I'm going to leave that needle in while we take these pictures for a little bit, so just try to keep your arms straight, okay? Okay. If you have any problems at all, just let me know. Okay, so I'm going to start with what we consider coned down over the kidneys. So I'm going to use the 14 by 17 crosswise. And I'm going to collimate down to 11 by 14 crosswise. So if you come up and in about a hand's width and place your marker, you should be pretty good.
11 by 14 crosswise?
Yes. Okay. Still doing okay? All right. Have to feel on you a little bit here. For this, over the kidneys, we want to be centered mid-sagittal plane and halfway between xiphoid and umbilicus. So mid-sagittal plane, halfway between xiphoid and umbilicus. Just make sure your patient's straight like you would for any KUB. And then we'll shoot all of these on expiration. So I'm going to ask her to take in a breath, blow it out, hold it out, but don't breathe. And if you were doing tomograms, this would be the centering for that. Plus, some people just do a cone down over the kidney shot anyway.
And that's just called a cone?
C-O-N-E-D, yes, cone down. It's really collimated down. Coned is an old term because they used to use cones as collimating devices, so that's just what we call it. All right. From there, we're going to do the obliques. I'm going to use the 14 by 17 lengthwise. And still I'm going to use this right marker and just put it at the bottom because these are going to be like KUBs. Actually be very similar to the obliques that you did for the BE, only we're going to rotate the patient less. We only want to go about 30 degrees.
You full collimation, right?
Yes, full 14 by 17 collimation. All right, we're going to center at the crest. Ask my patient to roll up towards me just a little bit, bring her arm across. Center to the crest, and like I said, you're going to be about like you were with the lumbar spine or those other obliques. Here's my lateral border, here's my mid-sagittal plane, about halfway in between. Just make sure you don't have excessive light in either direction. And so the RPO, hip and shoulder in alignment, just about 30 degrees. You'll be able to see the rotation when I turn it the other way. And this is going to show the right ureter separated off the spine, and then the left kidney in profile. Okay, so this is for right ureter and left kidney, the RPO. Okay. Let her, again, now we shoot this on expiration. Taking a breath, blow it out, hold it out. All right, let her relax. And then make sure the sheet comes with me and have her rotate away from me about the same amount. Bring it back down just a minute. There we go. So it's not a very big rotation. Going to stay at the crest. And then watch my light. We have full coverage. And now the LPO is going to show us the left ureter and the right kidney. Can you see that okay? But it's a little bit, I'm going to push. I mean, your shirt's way long today. So I just want you to see that. See, it's not very much. If it was 45, I would come up a little bit more. So I'm coming down to about 30. All right. If you need to, go 45 and then back off. That might be the easiest way to do it, is to take the 45 and then back off of the 45.
She's a professional patient, so she knows what that is.
Well, I have to adjust her sometimes, but yeah, she's pretty good.
She's done it a few times.
Okay. Yeah. All right, now you can roll back flat.
You use the right marker on that one too?
Yes, I would leave this exactly the same for both obliques because we're getting the entire abdomen, so that's still her right side, not going to be a problem.
We don't have to do like we did on the VE with this one where we take it out and stuff.
No, no, we'll just leave it. Okay, so I just wanted to get y'all a feel for timing with that.
Okay.
Okay, then the last one we're going to do is a coned down over the bladder. I'm going to use the 10 by 12 crosswise. And I'm going to use the right marker again down at the bottom. So it'll be full 10 by 12 collimation.
10 by 12 crosswise?
Yes.
The right marker at the bottom?
Right marker at the bottom. Now, there's a couple of ways you can approach this. Generally, what I do for this one is I find the ASIS, and I'm staying this side of the plane, and I center at the level of the ASIS, but then I'm going to check to be sure I've included the symphysis. You must include symphysis on this. This is like a little mini pelvis, kind of. I mean, obviously, you don't get the whole pelvis, but in as far as thinking about getting the symphysis on here. So I'm going to feel greater trochanter. I can see that my cassette is below that level. So I'm going to have the symphysis on here. Some people, they'll tell you to put your cassette at the top of the crest. And that's fine too. Y'all are all female. It should be fine. You have to be careful with using the crest on male patients though. Because with that heart-shaped pelvis, sometimes their symphysis is much lower. So wherever you start from, whether you start from the ASIS or you look at where the crest is, like I said, I find that if you go to the ASIS, you're going to be pretty good on that most of the time.
So
but double check and make sure you have symphysis. And if you don't, then center a little lower until you've included it. Okay? And don't just look at the light field, because depending on the size of your patient, that light field can get very small. And if you like put your light field at the top of the crest, you are in great danger of clipping the symphysis. If you look at the light field, I'm looking at, notice I pulled my cassette out, and I'm looking at where the bottom of my cassette is here. Here's her greater trochanter, about an inch or so above that. So I know I've got that included. If you're at a facility that doesn't use cassettes, okay, then my suggestion to you is this. Center up like you would. Move the patient away. Find the greater trochanter and make sure that it's still in your light field by just off-centering until you get the light on the table. And then you'll know if you've included it or not. And then just go back and center to the middle.
And there's no angle on that, right?
We're showing it this way. Everybody does an angle, so I want you to be able to center without the angle.
Okay.
If you go somewhere that does the angle, then find out what they're looking for with their angle. And just do the angle there. But that's something that only a couple of places do that, but they do it, and I think Gaston Regional does. And so, but we're going to show it perpendicular. Once you put an angle on, if you're angling caudal, then you're definitely going to get it. If you've got it before you angle, then you're definitely going to have it after you angle. So, and what angle they want you to use, I'm going to let y'all play that by ear. But like I said, I find that centering to the level of the ASIS is a good place to start. but you must be sure you include the symphysis. Excuse me. But does that make sense to kind of off-center? If you're using an angle, you're probably pretty safe with that.
Okay.
Because the angle is going to make up the difference. I mean, if you start the ASIS and then you put an angle on, you're probably going to get that. I would double check any male patient though, because their pelvis is just shaped so different. We've had students in here that their crest is seen very high, but to find their greater trochanter is very low, and that they've had to be centered lower. So I just warn people about that. You don't find it on females because we have a pelvis that's designed for birth and babies, and so we're shorter through the pelvis and we flare out more. But they don't. They go that heart shape and they have a tendency to come much lower.
Thank you for that flare.
Symphysis. So.
Oh, sarcastic.
All right. So those, and then this will be shot on expiration as well. Okay, that'll be the 4 positions that you position for, and then at this point, what I would say to my patient is, okay, I'm going to, you've done well. I'm going to go ahead and take the needle out now. Be sure you say something about removing the needle. Okay. Now, some places, if you have depending if the patient comes in through outpatient or you have a radiology nurse, they probably have hung a saline bag and you've injected through an existing IV line. If you've done a short-term IV that's been started by a tech, then chances are at that point you may have already removed this, but for our purposes here, just be sure you remove it before you get your patient up to the bathroom. Okay. Most reactions are going to occur within the first 5 minutes of injection, but they can actually be as late as 2 days later. Yeah, which is a long time, but most of them within the first 5 to 10 minutes. And so after that point, a lot of people, if it's a short-term worm, particularly a butterfly, will go ahead and remove, because when the patient starts moving around, you don't want them bending their arm, and so to damage anything in their arm. So. Just be sure, and I would do it at this point. I'd say, okay, after you do the bladder, remove the needle and say, I'm going to go check these. That way you haven't left them unsupervised with the needle in their arm. I'm going to go check these and I'll be back in just a minute. Will you be okay? All right, I come back. Okay, we have everything we need now. I need to let you get up and go to the restroom. Get your patient up, go to the restroom, empty your bladder for me again, come back for one last image. She comes back. I would shoot the one last image, which will be a post-void. We did a post-evac for BEs, but we do a post-void. That could end up being anything from that little come-down bladder like we just did, a full KUB, to an erect full KUB. Just depends on the protocol at your facility. But we'll just pretend like we shot them. Okay, will you be all right while I check this? Okay, tube's out of the way. All right, we got everything we needed. I'm going to go ahead and lower this table for you and let you sit up and get your balance. Okay, and I have some instructions for you. The doctor will be reading these and sending a report to your doctor the next couple of days. Okay. What I need you to do is to increase your fluid intake today, preferably water, but some type of fluid to help flush out the rest of that contrast medium. Most of it is gone now that you've gone to the restroom, but we want to make sure it all flushes out so you have good kidney function from that. Okay. The other thing is about your metformin. You need to stay off that metformin for the next 48 hours, but call your doctor and see if he needs you to have any lab work before you restart that. Okay. That'll be his determination. So you may want to call him today and say, you completed your exam and they told you not to take your metformin. Can I just restart in 2 days, or do I need to have the lab work? That way, you wouldn't have any problems from that. All right, okay? Do you have any questions for me? No. All right, do you have any other tests today? No. Okay, great. I'm going to take you back to your clothes. You can get dressed, hope you feel better, and get you something to eat.
Okay, thank you. I can call me.
Yeah.
Yeah.
Nectar the gods.
No, we don't allow this one.
They don't allow me alcohol, but I don't like it really anyway.
I don't want to have like energy drinks or anything like that, but I did have a coffee.
I had coffee one time, and I got to camp school in like 45 minutes.
You what?
We had to go to Wallace Hand School and we got there in 45 minutes. It should take us a little around.
Not a 45-minute drive.
Not usually. I had a van full of people. We'd gone to breakfast at, what do you call it? Cracker Barrel. I had about 4 cups of coffee, which I never drink coffee. I'd had cream
So
sugar.
you were like ready to go.
She had a lead foot.
Okay, space bar.